Ken Landau. Thanks for watching. Let's talk about Seysara, or sarecycline. It was approved in October 2018. It's a tetracycline antibiotic used for acne, used for moderately severe papular acne, those little tiny red bumps, not the big nodules. It's to be taken once a day. It's in the same family as doxycycline and minocycline. It's good against the bacteria that causes acne. We call it Cutibacterium acneus. In the old days, we used to call it Propianobacterium acneus. And it also is good against some skin organisms. We call them gram-positive organisms like that methicillin-resistant staph, the MRSA you hear so much about, or methicillin-sensitive staph, some other kind of bacteria. Well, the company licensed the drug, the FDA approved the license of the drug based on several studies. And there were 2 studies. They involved about 2,000 people altogether. The people were between the ages of 9 and 45, half of them between 18 and 45. They supposedly had moderately severe facial acne. They had between 20 and 50 of those little tiny red bumps. They had fewer than 100 blackheads or whiteheads, and they had no more than 2 nodules. Now, the investigators who were doing the study rated these people as mostly moderate. Well, actually, they rated them as 3.1 on the IGA scale. And what that means is they were considered mild if they were in the 2s. So these people were just a little over, a smidgen over mild acne. And they gave them the drug once a day. And the dose of the drug was based on how much you weighed. So you took 60 milligrams if you weighed between 70 and 120 pounds. You took 100 milligrams if you were between about 120 and 185 pounds. And if you were heavier, you took 150 milligrams. Again, just once a day. And there is no question. Acne was improved. The inflammatory acne, not the non-inflammatory acne, not the blackheads and whiteheads, but the inflammatory acne was improved. Well, let's take a closer look and see how it was improved. Well, in those people who were taking Seysara, there were 15 fewer of those little red bumps. And if you took a placebo, if you took a totally inactive medicine, there were 10 fewer red bumps. So supposedly, that accounts for the drug company claiming that you have a 54% improvement if you take Seysara. Well, you had a 35% improvement if you took the placebo. What's it mean in real terms? It means if you start off with 30 pimples and you took a placebo, no active medicine, and you didn't use any creams, well, if you were taking the placebo, you ended up with 20 pimples at the end versus 15 pimples with the Seysara. And remember, we're talking about those little teeny-weeny red bumps. So success was an investigator's global assessment that was either 0, you were clearer, 1, you had minimal acne. What's the likelihood of getting to that category with this very expensive drug? And the answer is that 22% of the people achieved a 0 to a 1 rating. The acne was basically gone, versus 11% of the people taking placebo. And the company says, hey, you're going to get better and you're going to start to show improvement by 3 weeks. And indeed, 29% of the people showed improvement by 3 weeks versus 22% of the people with placebo. And again, not using any topical creams. Well, the blackheads and whiteheads, they obviously didn't significantly improve. They didn't really evaluate the chest acne and the back acne as primary endpoints. They were considered secondary endpoints, and there was indeed some improvement. But remember, the people in the study were not allowed to use any topical acne product, which is the main product that you would use for acne. And if you go to their website and look at the pictures, you would say the people needed more creams than pills in the first place. And if you look at the graphs of the outcome of therapy, I tell you, you need a magnifying glass to tell the difference between the line with the drug and the line with the placebo. Now, if you take the drug, you have to reassess how you're doing at 12 weeks. The effectiveness hasn't been evaluated beyond 12 weeks, and the safety hasn't been evaluated beyond 12 months. You can take the drug with some fatty food with a meal or without a meal. If you take it with fatty food and a glass of milk, that's going to delay the absorption by about half an hour, decrease the amount that gets into the system by about 30%. But you have to take it with a sufficient amount of fluid so that it clears out of the esophagus, the tube going from the mouth to the stomach, because if it doesn't, it could cause ulceration and irritation. And you should minimize your exposure to light, natural light. Shouldn't go sit out on the beach. Don't go to a tanning bed if you happen to be taking the pill. Seems that it's okay if you have mild to moderate impairment of your liver or your kidney, you can still take the medicine. And the good news is, so far, it doesn't seem to be associated with a significant number of side effects, but there are relatively few people who've been studied on this drug. But at least so far, fewer than 1% have developed abdominal pain or diarrhea or vaginal candidiasis or dizziness or photosensitivity. 3% did develop some degree of nausea. So far, we don't have any vertigo or ringing in the ears that's been associated with it. There have been a couple cases of people complaining of dizziness, but no more so than in the placebo. We look at the adverse effects of the drug, relatively small number, a couple people with nausea or headache or vomiting. And all tetracyclines seem to be able to form some stable complex with calcium tissues. So we worry about taking the drug prior to full development of the bone structure. Now, as with any tetracycline, theoretically, can be associated with some vertigo or dizziness or lightheadedness. And if you develop diarrhea, you should stop the drug. There's a condition that we call Clostridium difficile diarrhea. It's due to an overgrowth of a certain kind of bacteria, Clostridium difficile, and a toxin that it produces. And it can end up causing a mild diarrhea all the way up to a fatal colitis. And if you take the drug, well, there's the possibility that it can increase the pressure inside the brain, increase what we call intracranial pressure, that can lead to some visual abnormalities, blurred vision or nausea or vomiting or headache. So you shouldn't take this drug with Accutane, and because it's what we call bacteriostatic, it doesn't kill bacteria, but it just wounds them. You shouldn't take the drug if you're also taking penicillin-type drugs like ampicillin or amoxicillin. And you have to be very careful. The drug is not to be taken with antacids that contain either aluminum or magnesium or bismuth preparations, and you don't take it with an iron supplement. There's a potential for fetal harm. It appears that there might be some reversible damage to the bones in unborn babies, so not for pregnant women, and by the same token, probably not for women who are breastfeeding. Tetracyclines, some of them have the possibility of staining the teeth when taken during the second and third trimester of pregnancy, all the way up to 8 years of age. So nobody in that age group should be taking the drug. It can alter what we call the prothrombin activity. So if you happen to be on warfarin or Coumadin, you've got to be a little bit careful. And if you happen to be one of the few people taking the digoxin type preparations, you have to be careful. It seems that the drug might interfere with spermatogenesis. So if you happen to be a guy and you want to start a family, maybe this isn't the appropriate drug for you. Well, tetracyclines, no question about it, can cause bacterial resistance. They can cause bacterial resistance of the organism that causes acne, and they can also cause some problems with the bacteria in the gut. And they can end up causing some GI side effects and vaginal candidiasis and a variety of other kind of problems. And how sarecycline is going to be in that family, or whether it's going to be in that family, or whether it's going to be, as the manufacturers say, unable to change the gut flora, we just really don't know. Now, there's just no question that, at least at the present time, the doxycycline and minocycline have more effect on the gut, at least as far as those organisms that we can measure. The unfortunate thing is that even at the present time, most of the organisms in the gut cannot be measured. So we can't really tell if there's going to be an effect on all those organisms, on the microbiome that we haven't yet been able to measure. Yes, indeed, the simple things that we can measure, well, it doesn't seem to have an effect on. On the other hand, those aren't the important organisms. It's the other organisms that seem to be very important for your continued good health. Well, if you happen to take the drug, the maximum concentration in the bloodstream is going to be about after 1.5 to 2 hours. The half-life of the drug in your system is going to be about 20 to 22 hours. About 60 to 75% is going to be bound to the protein. The rest is going to be free in the system and potentially active. It's minimally metabolized by the liver, doesn't appear to alter the drug metabolizing enzymes, and it's eliminated about 40% in the urine and 40% in the stool. There's no significant interaction if you happen to be taking a birth control pill. Actually, there isn't if you happen to be taking the minocycline or the doxycycline either. If you're taking the sarecycline, there might be a slight increase in the concentration of estrogen in the system, about 10%, maybe 20% with the progesterone concentration. Well, the question is, how common is acne? 85% of the people are going to have acne, especially if we look at the group of people between the ages of 12 and 25. About 20% are going to have severe acne. What do you do for acne? Well, for the standard acne, treatment is a benzoyl peroxide and a topical retinoid. And you can buy a topical retinoid over the counter now. Well, some people are going to need a topical antibiotic. And there are a lot of other preparations that you hear about that are highly advertised. They cost a lot and add a little. If you have significant acne, then we usually advance to a tetracycline type product. In the United States, that's doxycycline or minocycline. They're anti-inflammatory and they kill the bacteria. Now, there are also a lot of variations and derivatives of the generic doxycycline and minocycline. And again, they cost a lot and don't really add anything significant. If you have really bad acne, you can take some Accutane. Accutane is a very good drug for severe nodulocystic acne. But unfortunately, a lot of people have expanded the indications, so they're giving it to individuals who don't have the severe nodulocystic acne, and as a result, they might have some side effects. There might be some unexpected problems down the road. One of the problems is that Accutane causes some dissolution of the bone, so it sets you up for osteoporosis. And it seems that time doesn't allow the calcium to get back into the bone. So we worry about people who take the Accutane when they're in their 20s. What happens to their bones when they're in their 50s? Well, sarecycline was developed by a company known as Paratech. Paratech is out of Boston. They licensed the drug for development and commercialization to Warner-Chilcott. And as with all of the other products in the pharmaceutical industry, it has a complicated story. So Warner-Chilcott was taken up by activists, and activists merged with Allergan from Dublin. They kept the U.S. rights. They said, Paratech, you could have the all non-U.S. rights. And then in 2018, Allergan sold the drug to Almirall. Almirall is a company out of Barcelona. And Almirall bought some of the less popular drugs from Allergan. Allergan dumped Accutane, which is topical dapsone, and Tazorac, and Azolex, which are 3 acne drugs. And they threw in some Cordran tape, which is steroid-containing tape, and Seysara as a sweetener. Well, Allergan never considered Seysara as one of their strategic assets. Almirall bought these 5 drugs for about $550 million, and they said, if we can sell them and make a profit, we'll give you an extra $100 million. Actually, Almirall says they believe that the drug is going to bring in somewhere between $150 and $200 million. Well, they've priced it so that they can do that in probably a relatively small number of patients. The cost of the drug, taking 100 milligrams just once a day for a month, is going to cost, with a coupon, somewhere between $860 and $920. In other words, one pill is going to cost somewhere between $36 and $40. Now, you can probably get it for zero copay because the company comes out with these copay cards, but if you happen to be on Medicare or Medicaid or TRICARE, they say, well, here's the coupon for total cost of $60 to you, but we're still going to charge your insurance company a lot of money for this drug. And then your insurance company is going to raise your rate for next year. And then you're going to complain your rates are going up. You want to know why? Look at some of the drugs you're taking. And compare Seysara at $36 to $40 a pill versus either minocycline or doxycycline at 50 cents a pill. Is there any difference between the outcome of the two? No. No. As far as acne is concerned, equivalent, or maybe even a little better with the doxycycline, minocycline. So anyway, there you have it. That's sarecycline. It's a new tetracycline type antibiotic. Probably going to be a lot of prescriptions for it because people are insulated from the cost by the copay cards and by the insurance. But it's a really expensive drug. And as I said, if you look at the difference between the graphs on the company's own website between the drug and a placebo, you sort of need a microscope or at least a magnifying glass to tell the difference. Anyway, if you have questions about acne, you can watch our shows on doxycycline or Accutane or Epiduo. Appreciate your watching. If you enjoyed the show, we'd like you to recommend it to a friend. Maybe consider subscribing so you'll get the latest updates as we post new shows. Appreciate your time. I'm Dr. Ken Landau.